Hello, I'm David Hester. This is the Bible Health 101 show. Thanks so much for listening. Today you can find my website at www.biblehealth101.com. And in a number of posts and videos that I've made, I've been talking about exercise, cardiovascular exercise, resistance exercise. I've been talking about the benefits of exercise. And, you know, it's necessary, okay, to have good health. Exercise is necessary for good health. And, if you need more evidence than what I've shown you so far, then I want you to know that exercise can also help you to prevent several types of cancer, okay? Think of it. You lose fat, okay? That's one of the benefits of exercise. But you see, fat produces hormones that that speed up abnormal. Listen to me, I can't speak today. That speed up abnormal cell growth. Okay, so by getting rid of fat, by getting rid of excess weight, you're going to reduce your chance for these dangerous cells to thrive. Okay, uh, think of it this way. Okay, your insulin levels drop. Okay, um, I've talked to you before about how your insulin regulates your blood sugar, okay? And high levels of this hormone also play a role in tumor growth. So eating too much, especially the sugary foods and the fatty foods, okay, makes cells resistant to insulin's effects. So the pancreas ends up having to compensate by producing even more of this hormone. So your cells at that point begin to divide. They divide more rapidly, and that's increasing the chance for DNA errors. Okay, so exercise here is going to help us lose weight. It's going to help to restore the sensitivity of cells to insulin, and of course, this cleans the blood of excess amounts of insulin. Okay, now inflammation subsides. Okay, see, normally the body's inflammatory response repairs damaged cells, and protects the rest of the body. Okay, so uh, chronic inflammation, can put this kind of this inflammatory response into overdrive. Okay, and again can stimulate tumor growth. So, low impact exercises are going to reduce the risk of chronic inflammation. Okay, when you exercise, estrogen decreases. Okay, so estrogen, um, has been shown to encourage estrogen receptor positive breast cancer cells. Okay, so it encourages these cells to multiply. So if we get regular exercise, it's going to reduce our body weight. It's going to help to lower the amount of estrogen that's circulating in our bodies. Okay, now SHBG increases, okay, which is a sex hormone basically, and basically this hormone attaches to estrogen in the bloodstream. So when uh, when estrogen is coupled with this SHGB, okay, it's unable to fuel the growth of vulnerable cells. So high SHBG, okay, will um, of course lower your risk of cancer. Now, exercise helps you to protect your uterus. All right, um, you see the potential insulin and the estrogen lowering effects of long-term exercise will reduce your risk of endometrial cancer, okay, by about 30 to 40%, okay? So, that of course that's according to the 6-year Shanghai, cancer study, okay? that was conducted by all the researchers at Vanderbilt University, which is in Nashville. Now, exercise helps to protect your pancreas, okay? So people that are overweight, that are obese, are 72% more likely to get pancreatic cancer, okay? This totally changes if we maintain a healthy weight. Now, researchers at the Harvard School of Public Health have found that those who engage in 4 or more hours of walking or hiking a week, okay, can reduce the risk of pancreatic cancer in half compared to those who exercise fewer than 20 minutes each week. Now, exercise also protects your colon. Now, this is important because the bottom line is that you can lower your risk for colon cancer with as little as 4 hours of exercise in a week, okay? And research is suggesting that exercise, has this insulin suppressing effect that can, ultimately help save colon cancer patients' lives, okay? So patients that are going to walk 6 or more hours a week at a moderate pace are about 50% likelier to remain disease-free. Okay, so that was, of course, in the Journal of Clinical Oncology. Now, exercise also protects your lungs. Okay, now smokers, both past smokers and present smokers, who exercise moderately more than once a week, are going to be 21% less likely to be diagnosed with lung cancer, okay, than those who never sweat, okay, and that's based on the researchers at the University of Minnesota at Minneapolis. Now, the top way to protect your lungs, of course, and your overall health is to stop smoking, okay? I can never say that enough, all right? My father, when he had his heart attack, the doctor said that he had to, quit smoking or basically he was going to die, and my father was a wise man and he quit smoking. Okay, so in our next video, we're going to talk about weight gain. Okay, and we're going to talk about the principles of healthy weight gain, and how those principles are also similar in many ways to the principles of weight loss. So thanks so much for listening to the program today. If you have any questions or comments, please post them below the video, either on the YouTube station or at the website. Okay, be sure to visit the website at www.biblehealth101.com. God bless you.